Hi, my name is Sarah DeFelice, and the public health issue I focused on in week one was the social determinants of health. The social determinants of health span numerous subjects and topics. For this assignment, I'll be focusing on our physical environment, specifically our neighborhoods and access to transportation in regards to participating in the WIC program. The WIC program, otherwise known as the Special Supplemental Nutrition Program for Women, Infants, and Children, provides federal grants to states for supplemental foods, healthcare referrals, and nutrition education for low-income pregnant, breastfeeding, and non-breastfeeding postpartum women, as well as to infants and children up to the age of 5 who are found to be at nutritional risk. The state then takes that money and gives it to WIC local agencies. For instance, I work for the Marion County Department of Public Health, and we have a WIC program. A few years back, Marion County WIC collaborated with the Indie Hunger Network to find avenues to drive more eligible consumers to WIC. The Indie Hunger Network is a volunteer-led coalition of representatives from leading anti-hunger organizations, both public and private, as well as community volunteers. Early in the collaboration efforts between WIC and Indie Hunger, they identified a need for market research to provide a baseline of current awareness, understanding, and perceptions of WIC among the target audience of eligible consumers. So we looked at folks that were eligible for WIC services based on their income and category, and looked at those people that were not using WIC services and tried to determine why they weren't. So what we found in the WIC awareness baseline study was that the barriers to participating in WIC, 27% said they didn't participate because of social stigma and they didn't want to be on a government assistance program. 23% said that the enrollment process was a little tedious and long. 20% said they had transportation issues, and then another 15% said they had personal issues at home that impacted participation, as well as 5% had language barriers. My pitch plan focuses on those 20% of folks who are eligible for WIC services but are not participating due to transportation issues. A little history on transportation in Indianapolis area. It's not a walkable city. In addition, the public transportation consists of the bus system. The bus system here is constantly under scrutiny from the public because it's not very effective. They did build a new fast line, but some of the new lines are not going through the neighborhoods that serve our clients, which are low income and typically very diverse. We did try to collaborate with Indigo, which is our bus system before, and they gave us a bunch of free bus passes for our clients to come to and from their appointments, but our clients did not utilize the tickets and didn't take the tickets because they said they simply don't use the bus because they don't really have access to it. So my pitch then is to start a program that Marion County WIC collaborates with a vendor like Lyft or Uber to provide transportation services free of charge to our clients to get back and forth to their appointments. We would build a team, and this team would consist of key staff from Marion County WIC program, also key staff from our state WIC program so that they could get buy-in and maybe perhaps later fund this program for us. And then of course key staff from Lyft and Uber or whichever vendor would be interested in doing this. Of course the Indie Hunger Council, other private or public groups who advocate for hunger awareness so that possibly we could get some advocacy and some funding. And of course current WIC clients so that they can tell us if they think that this idea is a good idea, if they would use it, if it's feasible. So to get their input I think is very important. If everyone likes it and we move forward, I think the biggest hurdle is funding. So now typically the state WIC dollars or WIC dollars federally, state can be used for transportation. Right now our state is not giving us transportation dollars, but hopefully if we could get a program going, maybe with smaller grants, we could show them some data and that this program works, and then eventually we could then make it a more sustainable a program by getting funding that's not a small grant that would last for a while, and that would be from our state WIC program. So that's my pitch. Thank you.